There's always the threat of COVID, but right now we are getting into flu season as well, and the CDC is out with a wild campaign to get you and your family ahead of the pack.
But many are still hesitant to get another jab in the arm, especially after COVID. So we've got Dr. Suma Manjunath, managing physician of immunization practices at Kelsey-Seybold Clinic, joining us to talk about flu shots. Good morning.
Good morning, Melissa. How are you?
And Chelsea here. So what is this CDC's wild to mild campaign? Tell us about that.
So that is a social media campaign that the CDC has launched, essentially saying that the flu can be wild, causing you to miss a lot of school and work, and even maybe end up with a hospitalization or emergency room services that you may avail. So taking a flu shot will make it a milder illness. So that is the essence of that campaign. And so the flu shot definitely makes the disease much more manageable, and you might not miss as many days of school and work and be able to get back up on your feet and back to your routine quickly. So that's that.
I'm loving all the animals as we look at this wild and mild. It really is attention grabbing. What age do you suggest that parents really start thinking about getting their children a flu shot? And I'm wondering if the flu mist in their nose is still available. I know that sort of came and went.
So two parts to that question. So definitely everyone over the age of 6 months of age can take the flu shot. And definitely the young and the old are the most susceptible for a wilder illness. So certainly it is important that they all are vaccinated. The flu mist is a nasal live vaccine, and it is still available. It is approved for people over the age of 2 and can be taken up to the age of less than 50, which is 49 years of age. And you have to meet certain criteria since it is a live inactivated vaccine to be eligible to take it. So your provider should be able to give the guidance as to if you're eligible or not. But certainly the flu shot is very effective and can be taken as young as 6 months of age.
All right, so I have to admit my little one has gotten his flu shot during a doctor's appointment, but I still have to get mine. So how important is it exactly for parents to get that shot as well?
It is very important. So of course, the flu is a highly contagious disease, as you may have experienced in the household too. If one person gets it, everybody gets it. And so to protect all of ourselves and our family members, and especially if we interact with some of our older or younger family members, it's important everybody take the flu vaccine. And actually at Kelsey-Seybold, we will be having some flu clinics so that all the family members can come at once. And actually when we model the behavior, then it'll make it simpler so the children watch us and they get some strength, emotionally to also take the shot.
Okay, so if we're doing that, parents, just don't flinch. You gotta have a smile on your face. You're gonna scare the kiddos to death. Hey, what's your advice to parents who might be on the fence, or maybe just not motivated, maybe they're just too busy, and haven't been able to even think about getting their kiddos a flu shot?
So definitely, yes, there's a lot of ambivalence when it comes to the flu shot, but it is not a shot that will keep you from getting the flu 100%. But it is very effective from, again, like we described, the wild to mild, like making you have, if you do get exposed and if you are susceptible, have a much milder illness. And you will be protecting your family, your co-workers, your friends and relatives. So it will really be a great idea for everyone to take the flu shot. And who wants to go to the hospital for any reason? So it'll certainly avoid some urgent care emergency room or hospital visits due to the complications of flu also, which can be very, very common. So please take the flu shot. And based on the Southern Hemisphere data, it had been a fairly prolonged, early and protracted season there. So they had pretty severe illnesses, and all the people who had already received the flu vaccine had why is the less chance of even seeking any health care? And it's done a fantastic job down there. So I think it's important we all get vaccinated and protect ourselves and our near and the dear ones.
All right. So you're saying it's very effective this year. Good news to hear. Thank you so much for joining us from Kelsey-Seybold Clinic.
Thank you very much for having me.